Running a hospital requires coordinating dozens of moving parts. To keep things moving smoothly, your front desk registration, clinical care, and final billing all need to talk to each other without friction. Today, we are going to walk through a complete end-to-end patient journey inside Marley Healthcare, tracking everything from a patient's initial walk-in to their final automated invoice. To follow along with this workflow, make sure you are logged in with the Healthcare Administrator role on a fresh instance and that your default settings are configured. By mastering this connected workflow, you completely eliminate duplicate data entry across departments. Your clinical actions and financial operations become permanently linked. First, we map our physical hospital space by creating a consulting room and inpatient ward using the healthcare service unit type. You'll want to make sure the Allow Appointments and Inpatient Occupancy checkboxes are selected accordingly.
Next, we set up our clinical availability by linking a practitioner schedule directly to an employee profile. This step ensures that a doctor's booking availability is perfectly synced with your HR and payroll modules. With the facility mapped out, let's head to the front desk. When a patient arrives, we create a new patient profile, fill in their basic demographic data, and immediately book their patient appointment. This diagram shows the back-end automation in action. Because we enabled the Link Customer to Patient setting, entering that basic registration data automatically spawns a dedicated customer billing profile and triggers an automated SMS booking confirmation. This means the front desk can instantly collect and invoice the initial registration fee before the patient even sits down in the waiting room. Getting these structural and billing foundations out of the way early prevents administrative bottlenecks later. From minute 1, your patient is financially trackable. Now the patient moves to clinical intake. A nurse records vital signs like blood pressure and temperature, and the system automatically calculates the patient's BMI based on their height and weight. The doctor then opens a new patient encounter. They select the scheduled appointment, track the reported symptoms, and enter the specific ICD-10 code. If the patient needs further treatment, the practitioner can order a clinical procedure and schedule an inpatient admission directly from this exact same encounter screen. This chart plots quantitative vitals like blood pressure and temperature chronologically. Practitioners use the patient medical history dashboard to review the new encounter alongside all historical data. As new clinical events are added to the record, this visual history updates automatically in real time. For complex diagnostics, the system uses standard lab test templates, ensuring that every test format remains perfectly consistent across different patients and departments. There is also a direct link to inventory. When a doctor marks a clinical procedure as completed, the system automatically deducts the consumed stock items, like syringes or bandages, straight from the warehouse. By keeping the clinical workspace fully connected, practitioners can focus entirely on patient care, while the software silently manages inventory and medical records. For patients requiring an overnight stay, the doctor's earlier order automatically generates an inpatient record with an admission scheduled status, directly linking back to the initial encounter. The administration desk then assigns the admitted patient to an available healthcare service unit, such as a specific ward or bed. To manage the patient's care on the floor, nursing staff use the Inpatient Medication Orders module. This gives them a clear, real-time interface to track every drug administration exactly when it happens. Once the patient is ready for discharge, we move to the financial resolution phase. We initiate a new sales invoice in the Selling module, selecting the patient's linked customer profile. Instead of typing out line items, the billing clerk simply clicks Get Items From and selects Healthcare Services. This single click pulls all the clinical data into the financial document. The invoice instantly populates with the original consultation fee, the procedure costs, the exact consumables used, and the total ward charges. Fetching data automatically guarantees complete billing accuracy. You bill for exactly what was used, preventing revenue leakage caused by manual data entry. We have just traced a completely seamless journey, starting with a front desk appointment, moving through diagnostics and ward admission, and finishing with a fully automated final bill. Because Marley Healthcare is built on Frappe and erpnext, this single workflow instantly updated your financial ledgers, pharmacy inventory, and practitioner logs simultaneously.
To explore these features in more detail, check out the advanced tutorial modules in our playlist, where we dive into specific topics like lab test templates and managing insurance claims. True hospital efficiency comes down to a single principle: ensuring every clinical action taken to treat a patient instantly and accurately updates your operational business.